Every woman is entitled to get a screening mammogram by law every year, and she does not need a referral from a doctor. So every woman has that right, and so you do not need a referral. If there are extra things that need to be done, or an issue or a problem like a lump or an area of pain, then it is typically recommended that you have a referral. Preparing for a mammogram is as easy as getting dressed. So you just do your normal routine in the morning, avoid putting on any deodorant is the main thing, and show up for your appointment on time. There's different types of technology for mammography. Just about 5 to 10 years ago, most of it was film screen. So like the old days when you took a camera and you took a picture and you had to go get the film processed, that's how our mammograms were done as well. About 10 years ago, we transferred almost exclusively to digital. So like now we have digital photos. So that's the difference. And we can manipulate the image much more easily. Nowadays, our most current technology is called 3D or tomosynthesis. And that's a three-dimensional breast mammogram, which is our most up-to-date technology. You can have your mammogram any time of the month. It doesn't matter. It won't change the results of your mammogram. Some women get tender at certain times of the month, so you just would avoid those times of the month. Breast size and mammograms just present a different way that we would image it. Sometimes we would use several different images for one breast if the breast is larger than a smaller breast, when we can get the whole breast on the plate in one image. So if a woman has breast implants, we treat them just as every other patient, whether they have an implant or not. We just add 2 additional views. So they get the routine bilateral, what's called an MLO and CC view, which is our 2 standard views. And then we repeat those views, but we push the implant back as far as it can go and image the anterior breast tissue. Then we take an MLO and a CC view of the anterior breast tissue. Having a breast implant rupture during a mammogram is a common fear, and I understand it completely, but it is highly unlikely. Unless there are extenuating circumstances such as an increased lifetime risk, then women should start at age 40, continue with annual mammography. For women under 40, there are certain circumstances that warrant mammography. First and foremost would be a woman that's at high risk for breast cancer. And these are women that maybe have a genetic mutation in their family, or she has a personal genetic mutation that increases her risk, or she has a mother or a sister that had premenopausal breast cancer. In those cases, she would start her mammography about 10 years prior to the diagnosis time of her closest relative. If she's in her 30s and she has a diagnosis of a genetic mutation, then she would start at 30. When should a woman stop getting mammograms is a question that I love. Different societies have different recommendations. I feel like those are cold and impersonal. For many women, getting an annual mammogram is a life-affirming process. It's like getting their hair done. So it shows that she's still alive and kicking and ready to get up in the morning and live her day. Now, if we had a crystal ball, we would say, well, if a woman has less than 5 years of life left, then it's probably not worth getting a mammogram, since there's nothing that probably would be done with any of the results. But again, we don't have crystal balls. So I say, if you want your mammogram, come get it.